Knock knock. I'm Sarah. I'm going to be your nurse today. I'm going to wash my hands. The correct name is on the board. You're not on oxygen right now. You don't have a trach. You don't have any chest tubes or abdominal tubes. There's no clutter from the bed to the bathroom or any pathways. Your side table is here. You have your call light. You have your assistive devices near you. There's a trash bag over the side table, and the bed is in the lowest position, and both side rails are up. Okay, so Miss Phillips, what brought you in today?
I have a headache.
You have a headache. Worst headache of your life.
Yep.
Okay, if you could rate your pain, what would it be?
7 out of 10.
Okay, so we're gonna go ahead and get you checked out here. Let's get your vital signs. So blood pressure, okay, oxygen. We're gonna check your oxygenation in your blood. And then under your tongue. Good. Okay. Go ahead and just breathe nice and normal. And check your respirations. Okay. So blood pressure is 216/108. So that's a little bit high. Heart rate 92 beats a minute and regular. Respiratory rate is 20, and you're on 96% oxygenation on room air, so you're not on any oxygen right now, so that's good. And your temperature is 36.9 degrees Celsius. So, Ms. Phillips, where are you right now?
Hospital.
Okay, and how old are you? 43?
Yeah.
Okay. And, what's your name?
Miss Phillips.
Good, okay. Can you go ahead and sit up for me? Okay, go ahead and look at me and smile. Good, nice and even. Okay, I'm going to shine a light in your eyes. Good. Good. Pupils dilate. They're nice and round and even. I'm going to go ahead and listen to your heart and your lungs. Good. S1 and S2 are present. Nice and regular. Good. Let me listen over here. You're fine. You can relax. Good. Just relax. Okay, good. So your lungs are nice and clear. On both sides. Big breath. Good. Chest rises and falls nice and evenly. So go ahead and lay back down if you're comfortable. Okay. When's the last time you had a bowel movement? Okay. Are you having any pain with urinating or any frequency? Nope, no changes there. I'm gonna go ahead and listen to your belly really quick. Good. I'm going to go ahead and touch. If you have any pain, just let me know. Good. Soft, non-tender, not distended. Okay. Go ahead and grab my fingers. Squeeze. Good. Pull. Yep. Push. Good. Skin is nice and dry and warm. Good cap refill. Which finger am I touching?
Thumb.
Good. Which finger am I touching?
Pinky.
Good. No swelling anywhere. And your skin is nice and elastic. Good turgor. No swelling. Sorry. No swelling in your legs. Do you have any pain, numbness, or tingling in your feet? Okay. And check your cap refill on your toes. Good. Which toe am I touching?
Big toe.
Good. Which toe am I touching?
Pinky.
Good. I'm going to wash my hands. I'm going to check some orders. It looks like we have a few things that we're going to check in your blood via a blood draw. So we're going to check your total blood count. So that's going to check for any infections and give us a look and see what is going on in your blood right now. We have a basic metabolic panel that we're going to draw, and then we're going to do a CAT scan of your head, a chest x-ray, and it looks like I will be inserting 2 IVs, and if your oxygenation, the thing that we put your finger on, would drop below 92%, we're going to go ahead and put you on oxygen with the little things that go in your nose, and it just wraps around your ears, just to keep it above 92%, okay? Do you have any questions about that? Okay. After I insert your IVs, I'm going to give you 5 milligrams of metoprolol through your IV. So we're going to have normal saline run just to keep you nice and hydrated. And I will push that through your IV. Does that make sense? Okay. We have hydralazine, 10 milligrams IV push, PRN, for blood pressure, that is your systolic, which is if it's above 200, so that's that first number. And then he also prescribed 2 milligrams of morphine as needed for your pain. Okay, so if you need it, just let me know. We'll check back in and monitor that regularly. So go ahead and I'm gonna insert your IVs. Okay, wash my hands. Okay, so there's an IV in here and an IV in there. We have normal saline running, okay? I'm going to go ahead and we did a rainbow draw off of this arm, so that your lab work should be done in the lab now. So we're going to go ahead and push this metoprolol. I'm going to wash my hands, get my medication ready. What is your name?
Miss Phillips.
Okay, and your date of birth? Good.
Yep.
Okay. So just identifying that you are who you are. I'm going to scan your bracelet. I'm going to go ahead and push this medication over 2 minutes. So nice and slow. And there's no pain, no swelling, no redness. Are you feeling okay with this?
Mm-hmm.
Okay, good. Making sure it's still recording. Alright, so 2 minutes has elapsed. I'm going to go ahead and let X-ray take you down, and then I'll come back in and check on you in a couple minutes, okay? All right. Wash my hands. All right, knock, knock. I'm going to wash my hands. How is your pain, Miss Phillips?
7 out of 10.
Still? Okay. Oh yeah, and I forgot that we did attach this cardiac monitor too, okay? I forgot to tell you that. So 7 out of 10 pain still. So we're going to go ahead and I'm going to give you 2 milligrams of morphine, okay? Same way that we just gave your other medication. So hopefully that'll start working. So wash my hands, put some gloves on, prepare the medication. Miss Phillips, what is your name and date of birth?
Miss Phillips.
Good. Okay, good. I'm going to scan your bracelet so we know who you are. Scan the medication. I'm going to push this over 2 minutes, nice and slow. Okay, 2 minutes has elapsed. I'm going to give you some time to rest. That should start working in about 15 minutes. So I'll come back in and check on you, okay? All right, here's your call light. Let me know if you need anything, okay?
Okay.
All right. Wash my hands. Knock, knock. All right, Miss Phillips, I'm going to go ahead and get a fresh set of vitals on you, okay? So I'm going to wash my hands. And I'm going to, there's your blood pressure cuff. I'm going to grab your finger for your O2, good. Under your tongue, good. I'm going to count your respiration, so just go ahead and breathe normal. Okay, good. So, it looks like your blood pressure is still pretty high. It's 204 over 102. Heart rate is 86. Oxygenation is 94% on room air, so that's still good. And your respiratory rate is 14, which is still pretty good, okay? How is your pain?
7 out of 10.
Still? Okay. All right, so go ahead. We're going to go ahead and give you some medication to help bring that blood pressure down just a little bit. We don't want it to come down too fast because then that will cause other issues that we're trying to prevent, okay? So I'm going to go ahead and wash my hands, grab some gloves, prepare the medication, verify that you are who you are, scan your bracelet. I'm going to go ahead and push this hydralazine over 2 minutes, 10 milligrams. And that's due to your systolic, that first number being over 200. So nice and slow. And some labs came back, it looks like, and your glucose was 193, so that's good. A little bit high, but that's okay. Your A1C is 9.2%, and your BNP is 160, okay? All right, so 2 minutes has elapsed. I'm going to go ahead and leave you be for a little bit, try to get some rest. Let me know if you need anything or if anything changes, okay? Does that make sense?
Yep.
Okay. Here's your call light. Okay. I'll be back. Wash my hands. Knock, knock. Hi, Miss Phillips. I'm just checking in on you real quick. How are you feeling?
Can't feel the right side of my body.
No?
Nope.
Okay. And your face is, can you smile for me? Okay, so your face is drooping on that side too. So I'm going to go ahead and get the healthcare provider on the phone and see what he wants to do. Okay, sure. All right, so Miss Phillips, we're going to go ahead and move you down to a different room to get some better care for you. We're going to take you down to the ICU, okay? So you're now moved to the ICU. You were taken to the operating room to remove a hematoma. So you have suffered a stroke on the left side of your brain, which affects the right side of your body. So that's why you couldn't move the right side of your face or the right side of your right arm or right leg. Alright, so after 2 days of being in the ICU, you have recovered fully, and I'm going to report off to the nurse who's going to take care of you now. So, Michelle is the nurse. She is going to take care of you until you leave. So, Michelle, this is Miss Phillips. She came into the emergency room a couple days ago now with the worst headache of her life, 7 out of 10 pain. No previous medical history, and her blood pressure upon arrival was 216 over 108. Her other vital signs were decent. We did give her 5 milligrams of metoprolol. 30 minutes later, we checked again. Blood pressure was still high, which resulted in hydralazine, 10 milligrams IV push. Ended up moving to the ICU. Right-sided weakness, couldn't move, facial droop on the right side. She did suffer a large hematoma found on the left side of her brain. We did let her family know that she had a stroke because of her high blood pressure. She has recovered all of her movement and her arms, her speech, and her face symmetry is normal. She has transitioned from IV medications to oral medications now, and she has been moving around well on her own. She in the past has never known to have high blood pressure, so I did notify her that it would be best to continue to follow up with her family physician regularly to get well checks to keep everything under control. I did inform Ms. Phillips that although she may be feeling a little bit better with taking this medication at home, that it's very important to continue to take the medication because if you don't continue to take it, then your blood pressure will start rising again and we'll be chasing it. So I informed her of the importance of that, and she's going to follow up with her family physician in the next week. She's pleasant, cooperative, and she will be discharged later on this evening. Any other questions? Okay. Ms. Phillips, I hope that you start feeling better, okay?